Good morning, guys. It's Dr. Jennifer Grameth here with W.A.Y Health and Wellness, and I am super excited today to be sharing with you one of my favorite systems of the body and my specialty, the lymphatic system and the immune system, and its role in you achieving optimal health. So whether you are a practitioner, a therapist, or a client, this is information that you do not want to miss, and you want to really get a great understanding of how important this system is for your overall health, if that's what you're seeking. I know I'm seeking to be as healthy as I possibly can, and many of my clients coming in here, that's what they're looking for too. And so let me introduce you to the lymphatic system. Now, the truth is, really, most people have never even heard of their lymphatic system, much less lymphatic drainage. Some people have heard of lymphatic massage, which I'm going to explain to you the difference between lymphatic drainage or assisted lymphatic therapy and lymphatic massage later. This is really because it wasn't identified and really started, as practitioners, we didn't really start looking at the importance of the lymphatic system until the late 70s. And so I know that when I was in school and I was learning about every system of the body, when I worked in mainstream medicine, I didn't know a whole lot about the lymphatic system. I had a chapter on it in school, and every other system, we had a textbook on it. And when I even began to get in this field, there was very little information about the lymphatic system. But fortunately for us now, there's been more and more study about the lymphatic system and the importance, where even USC scientists made this statement. They said the lymphatic system is no less essential than the blood circulatory system for human health. Guys, this is huge, because we used to kind of separate each systems of the body. You cannot separate the lymphatic system and the circulatory system. The lymphatic system is piggybacked to the circulatory system, and so they go hand in hand. So I'm going to talk about how we're going to stimulate the lymphatic system, but I want you to keep in the back of your mind the idea of when you are stimulating your lymphatic system, you're also stimulating the circulatory system as well, and other systems of the body like the endocrine system, the digestive system too. So improper drainage of the lymphatic system results in an impaired immune system. It can lead to cancer, it can lead to heart disease, diabetes. So all of this is connected. So let me explain to you what I mean by the lymphatic system and the immune system and how they're connected, okay? Your lymphatic system is the structure that holds or contains your immune system. So if your lymphatic system is congested, your immune system is now compromised. And I have found that more than 50% of Americans have a pretty significant degree of congestion in their lymphatic system. And this is why we're seeing an incline and a rise in chronic illness here in the United States, one of the reasons. So I believe that the lymphatic system is that missing link. It's the connection between congested, contaminated lymphatics and chronic disease processes that are going on. And if you ignore it and you just treat the symptoms that come along with the chronic disease process, you're missing the opportunity to see complete healing in your client or your body. The lymphatic system is one of the most overlooked systems in the body, and it's because of our lack of knowledge in the past about the lymphatic system and its role in your overall health. Keeping and maintaining the lymphatic system, keeping it in top shape, keeping it circulating, keeping it moving, keeping it decongested, that is going to help you maintain a healthy life. And like I said earlier, most Americans have 50% or more congestion in their system, which compromises their immune response. Think about your immune system as your army of defense. It's your little soldiers, okay? The lymphatic system is the vehicles transporting these soldiers to the battleground. So if your lymphatic system is not functioning properly, is not working, it's congested, the vehicle is broken down, the soldiers cannot do their job. And so our job as a practitioner that specializes in stimulation of the lymphatic system is to circulate those soldiers, those T cells, B cells, macrophages, and get them to the battleground where we have been invaded, whether it's parasites, fungus, viruses, bacteria, whatever's invading our body. The immune system is designed to clean it up, to destroy it, and to bring homeostasis back in it to it. So you can't just throw supplementation that creates die-off because it's not getting anywhere. You're not getting the circulation of the supplementation because the lymphatic system is congested. I'll explain that a little bit more. So your lymphatic system performs vital functions in cleansing the fluid that surrounds the cells in your body by removing the impurities and waste products. Some people know that, okay? They know and they think of the lymphatic system as the garbage disposal, and that is so true. It is your garbage disposal. It is what detoxes you, and when functioning properly, it does a very good job to keep us healthy. However, it is also the system that bathes every cell in the body with nutrients. So when it is congested, when it is overwhelmed, you are malnourished. It doesn't matter if you're taking a lot of supplements, and I see this every day in my practice, patients taking tons of supplements and they're still feeling terrible. Why is that? Because of malabsorption. They're not absorbing the nutrients from the supplements or the foods that they're eating, so they're still malnourished. So it is our job, and what I have found with these types of clients in the past is that once we start stimulating their lymphatic system, they require way less supplementation and they get greater results, and they start to feel better and their body starts to heal and they start to release toxins that they've stored for 5, 10, 20 years. So an unhealthy lymphatic system will and can cause serious impact on your health and lead you down a road of chronic disease like everybody else. So studies have shown that an unhealthy lymphatic system contributes to chronic disease. That's obvious. But we don't think about some acute issues like migraine headaches. We don't think about our lymphatic system when we notice that we have cellulite. Cellulite, guys, is just a way that the body is trying to protect you because it's taking those environmental toxins, those heavy metals, those chemicals, and it's storing them because those are very, very harmful to your vital organs. So the first step of the immune system is to take those and store it in the adipose tissue to protect your vital organs. And that's what you see when you see cellulite. So cellulite is not just a disorder of obesity. You see cellulite in young children. Look around you, look at the young girls and how much cellulite the very thin girls have on the backs of their legs as well. And so it is not a disorder of just obesity. It is a problem of toxicity. So statistically, let's talk about some of the chronic diseases that I deal with my clientele. And cancer is a huge part of my clientele, and it's cancer patients who have undergone chemotherapy, radiation, surgery. Very few of them start with functional medicine. They typically start with allopathic, and then when that doesn't work for them, they come to functional medicine, or they've done the allopathic way, and now they are looking to rebuild and restore their immune system, which is my specialty. And so I want you to look at some of the statistics, because if you're a practitioner out there listening to this, you need to know how important this type of modality and therapy is for your practice. If you're a patient out there, you need to understand how important this therapy is for your overall health. Back in 2016, it's estimated that 1.6 million new cases of cancers were diagnosed in the United States. 600,000 of those individuals will die from the disease or did die from the disease. I think the new estimated total is 1.7 million new cases this year of cancer diagnosis, and half of those will die from the disease. So it is a problem. It is a very serious problem, and it disturbs me that I am seeing more and more children with cancer. And so we can't ignore it any longer. We can't continue to use the same methods that we used when we continue to see an increase in the cancer cases. And so cancer is not a disease from a deficiency of chemotherapy and radiation or surgery. If you truly want to cure cancer, if you want to find the cure to cancer, you look at the lifestyle of the individual. Look at their exposures, look at their stress. What are they putting into their body? You have to find the root cause of it. And in later webinars, I will talk about some of the root causes. The most common cancers in 2016 were breast cancer, lung cancer, bronchial, prostate, colon, rectal, bladder, melanoma, non-Hodgkin's, thyroid, kidney, renal, leukemia, endometrial, and pancreatic cancer. And so history behind my knowledge of the lymphatic system, I'm going to tell you a little bit about my story. I used to work in the field of oncology. I worked in oncology, cardiology, internal medicine, and my early intern was in colon and rectal specialist. And so I know the side of mainstream medicine, and I appreciate the knowledge that I gained from that. And I appreciate our doctors and our scientists, because in their heart, they truly want to help people. However, there's a disconnect because they're not trained in health and nutrition and how to have a healthy body. They are trained in emergency medicine, and that is exactly who you want to go to if you have an emergency situation. You don't go to a naturopathic doctor like myself if you're having a heart attack or if you are injured in a car wreck. You seek emergency care, and that is what they are known for. That is what they are excellent at. We have the best health care as far as emergency medicine in the world, in my opinion. However, it lacks greatly when dealing with chronic disease. They don't know how to deal with chronic disease because chronic disease is caused from, in the majority of cases, lifestyle, okay? And they're not trained on that. So my story began when my father was diagnosed with lymphoma cancer. He had tumors the size of grapefruit in his abdomen, under his arms. He was a crop duster and had the chemicals directly sprayed, which we think is the cause of the lymphoma cancer. It could have also been the fact that when he was a child, he would spray himself down with DEET almost on a daily basis and go out and work in the fields. And so it's the accumulation, guys, of toxins through over years that lead to chronic disease. Okay, so if you don't practice regular detox, and more and more people are hearing the buzzword about how important it is to detox the body. If you don't practice regular detox, you're going to go down that road of disease, whether it's cancer or heart disease, diabetes. It is all caused from the toxins that we're exposed to, the stress that we deal with in our life, and the deficiencies that we have in our diet. So working in mainstream medicine, my father gets this diagnosis. I'm devastated. We, of course, start chemotherapy, radiation. Shortly, we hear that it's not working. and it's destroying his heart, and they gave him less than 2 months to live. I could not believe that I could not save my father. So I sent him to Dallas, Texas, because I felt there was better cancer facilities there. He went, was reevaluated. Doctors told him the same thing. There's nothing we can do, Mr. Gardner. Your heart's too weak. You can't withstand any other further chemotherapy, and you have too many tumors to do surgery. So you need to go home, get your affairs in order. That's it. My medical director came to me because he saw how upset I was about this diagnosis with my father. And he said, Jennifer, why don't you try functional medicine? Back then it was referred to as alternative medicine. I don't like that phrase because it's not alternative. It's not either or. It's in conjunction with in many cases. So functional medicine I like. He said, Jennifer, why don't you try that? You have nothing to lose. I thought, well, if I didn't learn it in medical school, then it can't truly be valid, right? Little did I know. So he introduced me to a man that cured himself of a brain tumor. His name is Jim Hankstepper. He still owns a little herb shop in Chattanooga, Tennessee, and as far as I know, he's never had a reoccurrence. He's an amazing man who has a heart to help people heal. I went to him, took my father, very reluctant to listen to what he had to say. So if you're a patient out there and you just don't know about this, I know exactly how you feel, because we are trained and we are taught to think only a certain way. And I didn't make the connections of my father's lifestyle causing his cancer. I believe that it was just dumb luck. It just, fell out of the sky and obviously hit him on the head. I really didn't think about it. And so Jim explained to me how it was a lifestyle issue. And if you don't address it at that level, they're not going to see any healing in the body. And so what he said made sense to me. And he put my father on a protocol. He changed his diet. He gave him some supplements. He made some recommendations on how to deal with the emotional trauma of the diagnosis and just emotional trauma that he's went through in the past. And I sat by, very critical, but hopeful. I had a little bit of hope because I didn't have any hope prior to that visit. We went back, we implemented what Jim had told us to do. I went back to work. I'm watching my father get stronger and stronger, and my patients get weaker and weaker. And I couldn't reconcile that. That didn't make sense to me because it wasn't how I was trained. And so after 6 months, my father's tumors had shrunk half their size. A year later, he was cancer-free. And it changed my life forever. And so that is my story. I started working with cancer patients because that's where my passion is. I wanted to help them to overcome this chronic, devastating disease. And that is where my heart is still today. But I noticed that after just a few months of putting them on dietary changes and supplementations, that it felt like I was hitting a wall. And I still had a success rate with stage 3 and stage 4 cancers of about 35%, which is way more than I saw in traditional oncology, which is 4 to 8%. So, that it was better, but it still wasn't good enough for me. I wanted a 100% success rate. And I started reaching out to my colleagues, Dr. Lee Cowd and Dr. Thomas Crowley. These are world-renowned physicians that practice functional medicine. And I had one particular case that was very close to my heart, and he had lung cancer, and he was having to have his lungs aspirated on a weekly basis. And he did well initially, and then he started to digress. His cancer marker started to creep up, and this was common for me to see. And I would usually critique their regimen, and sometimes it would work and sometimes it wouldn't. And so I grew very close to this particular patient. And I was devastated that his cancer markers were climbing up, that he was having to go through this procedure. And so I reached out to these doctors and I said, what am I doing wrong? And they said, Jennifer, are you addressing the lymphatic system? I said, oh, of course. I'm giving them homeopathics, I'm giving them supplements. And he said, no, you have to address the lymphatic system as a whole. You got to decongest it. And I said, well, how do I do that? And they said, well, what I know is using inert gas ionization devices will dissolve the congestion in the lymphatic system and boost their immune response. I said, I'm sold. Send me one. Tell me how to do it. I started using this on this particular cancer patient who had to have his lungs aspirated. Within 5 weeks of having therapy on a weekly basis, he no longer had to have his lungs aspirated. One day he was late for his appointment and I thought, oh no, wonder what has happened. I saw his car pull in the parking lot like it hurriedly, and he jumps out, and prior to that he was always driven by his wife and he was still in his wheelchair. He's getting stronger, getting better, could breathe better, but was still very weak. Well, this day he pulls in, comes in, he's drenched in sweat. He looks pretty rough, but he's walking. He's not being brought in by his wife. I'm like, Robert, what happened? What's wrong? He said, oh, Jennifer, I felt so good. I was outside pressure washing the house, mowing the grass, and I realized it was time for my appointment. So I jumped in my truck and I ran here as fast as I could. And I was so happy because he said, Jennifer, I have laid in that bed for months and months, planning my death and trying to get everything fixed for Mary before I passed away. And now that I have the energy, now that my body is healing, I'm going to fix all these things that I wished I would have done prior to that. And it was a beautiful thing, and he did extremely well. And so it took my success rate just by implementing this one modality in my practice to 70 to 85% success rate with stage 3, 4 cancer patients, also with Lyme, also with autism and other chronic diseases. So it was huge impact, this one modality. And I use different modalities in my office, guys. It's not just lymphatic therapy, but it is the foundational therapy because it is so important, and it is the missing link that many practitioners do not use. And if you are a practitioner, you need to have this in your office. Every other modality, every other protocol will work much, much better if you implement this one modality. So what are some of the most common lymphatic disorders? Well, there is the disorder lymphedema, which we kind of talked about a little bit. Lymphedema is actually a disease of the lymphatic system. There is primary and secondary lymphedema, and we're going to talk mostly about secondary lymphedema because that's what we typically see. Secondary lymphedema, majority of the times, is a man-made disease, and it is due from surgery, chemotherapy, and radiation. But it can also be from trauma. I see lymphedema in a lot of pro football players from all the impact and the scar tissue in the abdomen blocking the lymphs and leading to bilateral lymphedema cases. So there are other causes of lymphedema. Now, lymphedema sounds like lymphedema, and you may think it's the same, but lymphedema is a disorder of the lymphatic system that is in the adipose tissue. It's typically lower extremity and bilateral, so it is typically in the hips and in the thighs of an individual. Looks very much like cellulite. And so many times it's misdiagnosed as cellulite, and physicians will tell the patient, oh, you just need to lose weight and it will go away. It's just cellulite. I'm going to tell you how to determine whether it's lymphedema or just cellulite. Well, lymphedema is inflammation in that adipose tissue because the lymphatics run all through the adipose tissue. Now, sometimes This is caused from liposuction. Sometimes it's just caused from environmental toxins, and your body, your immune system is so compromised, it's just in a state of inflammation. And your immune system and your brain is so complex, and it's constantly trying to keep you alive and keep you healthy. It will, when you have these exposures, it will store them in the least impactful place first, and that would be the adipose tissue. So you have all of this toxins, all of this inflammation stored in the adipose tissue in hopes to save the vital organs and glands. Eventually, immune system continues to become more and more overwhelmed. Toxins go higher and higher. It will cause damage to the organs and glands. You've heard of lymphoma. Lymphoma is a cancer in the lymphatic system. Hodgkin's lymphoma, non-Hodgkin's lymphoma, both are serious. One is very quick and progressive, one is very slow growing. My father's was very quick, and it was non-Hodgkin's lymphoma. Lymphadenopathy, what's that? Well, lymphadenopathy is just swelling in the lymph nodes. You may see that visibly on children or on adults, where you'll have swollen lymph nodes in the neck. You can also sometimes palpate under the arm. These are called the axillary lymph nodes. They're the regional lymph nodes. They will swell up and you can feel it. It will be, you know, like the size of an olive or an egg, depending on how much infection is in there. Also in the inguinal, right in the groin is another area where regional lymph nodes. You have lymph nodes throughout the body, lymphatic vessels, very similar to the blood vessels. But the difference between cardiovascular and lymphatic system is that the cardiovascular system has the heart as an automatic pump. The lymphatic system doesn't have an automatic pump like the heart. It does have a spiral muscle around the vessels that contract and move lymph, but it requires movement on your part. Deep breathing is very helpful for the lymphatic system. Exercise, rebounding, all of those are helpful. And so you can see why we're seeing more and more cases of lymphatic disorders, because Americans have become very, very stagnant in their lifestyle. And then with the increased amount of environmental toxins and stress that we have on us today, no wonder we have more and more chronic diseases developing. Lymphocytosis is an increased amount of lymphocytes in the bloodstream, which indicates infection in the body. Lymphangiitis is inflammation, typically of the vessels. Kind of looks like blood poisoning. So sometimes you'll see a visible sign, a streak, a red streak going to the area of infection, usually to the lymph node, like you'll see it in the arm, but it's just inflammation of the vessel, infection in the body. And so those are some of the common disorders of the lymphatic system that we as practitioners would be looking for. Lymphedema is one of the most common chronic disorders of the lymphatic system that is interesting, because it's the one most misdiagnosed initially. Now, when you see it as stage 4, like you see right here, I mean, it's obviously that they've got an issue with the lymphatic system, but we need to, as practitioners, be able to diagnose it in stage 1. Now, I'm a lymphedema specialist, so I am trained to do this, but all doctors need to be trained to identify this, when half of all cancer patients will develop this, right? And so if we can catch it in stage 1, which is where it's barely even visible, you see a little bit of difference between the arms and the hands. What you will notice is that the client will tell you, if you listen to them, that, you know what, my arm feels heavy, or my leg feels heavy, and something's just not quite right. It's a little bit bigger, I think, than the other, extremity, or I can't sleep good at night because it's just uncomfortable. Those are all early warning signs that lymphedema is starting. Now, lymphedema can start within weeks of a procedure. It can take years before you see the effects of lymphedema in some cases. So it just really is dependent upon that person and their overall health. And so stage one, you can diagnose it by listening to the client's symptoms. Stage two, you can kind of see that there is a greater thickness in the extremity. Typically, patients will start complaining in stage two, in stage three, and still be ignored by their doctor because they don't know what to do with it. They may try to give them a diuretic. That's the worst thing you can do for lymphedema. It may bring the swelling down just a little bit, but then it balloons right back up and it can cause damage to the kidney. So you may, if you're a practitioner and you deal with a lot of cancer patients, you may occasionally see a primary lymphedema, and that's due to a birth defect. That's the lymphatic system, the structure of the lymphatic system did not develop properly. And so those individuals may need lymphatic therapy the rest of their life because of the structural issue that they have. Now, surgery causes a structural issue. So when the doctors remove axillary lymph nodes where they have found cancer, your lymph system doesn't drain properly, and so it will back up, and that's secondary lymphedema, which is what you see here. And these cases were due to surgical procedures or radiation. And so you can see that this is a huge problem. This is a very disturbing, disfiguring disease process. And I believe because 90% of the cases are going to be man-made, it's our responsibility as practitioners to make sure that we get them early diagnosis and get them in with a lymphedema specialist or an assisted lymphatic therapy almost immediately to prevent this disfiguring disease. So some other signs and symptoms, like I told you, you can listen to your client if they say that they have swelling in some area of their body, whether it's their arm, their leg. You can have abdominal lymphedema as well, so don't rule that out. If they just feel swollen and bloated after a surgical procedure or radiation, pay attention to that. They typically feel heaviness and tightness in the affected area. They may tell you they have restricted range of motion, aching and discomfort, especially at night. Reoccurring infections, they get scratched, it just doesn't heal, much like a diabetic would. You will see that with lymphedema cases. Hardening and thickening of the skin, which is in the later stages, which is called fibrosis. And so these are the signs and symptoms of a very compromised lymphatic system and immune system. But what are some other symptoms before you get to those later stage and get to actually a disease of the lymphatic system? Well, chronic fatigue is a huge red flag that something's going on with their lymphatic system, okay? 2.5 million Americans suffer from chronic fatigue. That's huge, guys. 2.5 million Americans. Muscle aches and pains, 51 million Americans. That's 1 out of 2 adults complain with pain. Any inflammatory process in the body has to do with the lymphatic system. When your lymphatic system is decongested, you do not have inflammation. Remember that. Frequent infections or virus, it's too high to count. Everybody complains with viral overload or frequent infections. They're just not feeling as well. They get sick too often. It's very, very high numbers. Fibromyalgia, I've heard this for the last 15 years in my practice. You know, patients go to doctors, they don't know what's causing their pain and their inflammation. It moves around. They label it as fibromyalgia. 10 million Americans are suffering from this, and 75% are women. This is an inflammatory process going on in your body due to an overwhelmed, congested lymphatic system. It's amazing when you decongest the lymphatic system, fibromyalgia symptoms completely gone. Cancer formation to date is 1.7 million new cases being diagnosed this year in the United States. And so all of these are signs and symptoms of a compromised lymphatic system, a congested lymphatic system, which compromises your immune response. So what are the steps that you can take if you're a client or if you're a practitioner to help maintain a healthy lymphatic system? Well, number one is the food that you put in your body. Guys, it makes sense that if you put garbage in, you're going to get garbage out. And so the foods that are good for the lymphatic system are lots of veggies, certain fruits like berries, some citrus fruits if you're not sensitive to them. Greens are great because greens are chelators. They bind heavy metals and other types of industrial chemicals and take it out of the body. Lots of water, clean water. You would think if you have swelling, don't drink water, but you need water even more. It will flush the toxins out. Your body is retaining fluid because it is overwhelmed and congested and dehydrated. So it's trying to hold on to all of that fluid. Once you hydrate the body, it will start releasing the fluid if you decongest the lymph. Some other activities, if you have a serious compromised lymphatic system or congested lymphatic system where you're having any of the signs and symptoms, whether it's fatigue, fibromyalgia, neuropathy, migraines, any of those, you would want to do lymphatic drainage, and I'm going to explain that. But other things that you can do is exercise. Dry brushing has been known to be effective, especially with the superficial lymphatics. Deep breathing helps to move the fluid through the lymphs when it is congested. And so practice all of those techniques on your own at home. What you want to avoid is stress. Now, I know we can't avoid stress. Stress is all around us, but you can shift your mindset and your perception of stress in your life so that it doesn't trigger inflammation in your body. Iodine deficiency can also cause sluggishness in the lymph. Exposure to pesticides, industrial chemicals, smoking, prescription drugs, and you may not even be taking prescription drugs, but have them in your system due to the water supply, the contaminated water. So you may be drinking filtered water, but you want to make sure that you are bathing in filtered water as well, because your skin is your largest organ, and it is where you're absorbing toxins into the lymph and the bloodstream if you are bathing in tap water. Meat, if it is not grass-fed, if it's pumped full of hormones and antibiotics, it's very congesting to the lymphatic system. Dairy, I mean, you eat dairy, typically processed dairy, within minutes you can feel the congestion start in the sinuses, so it causes great congestion in the lymphatic system. And then also food additives. So eating clean and green and lean is very important. Exercise is important. Dealing with emotional stress is important for a functioning, healthy lymphatic system. So treatment options, if you already have just an overwhelmed, compromised lymphatic system, you're not alone. Most Americans do. You know, 95% of the patients who come into my office have very compromised lymphatic systems, from children to elderly. So some treatment options, there's manual lymphatic drainage therapy you may have heard about, where they use manual massage, compression bandages, and garments. And that's typically used for lymphedema cases. And then there's the XP2 assisted lymphatic therapy, which is what you see on the slide here, where they use inert gas ionization. It uses argon, krypton, and xenon gases, and it decongests the lymph. And it's a full body approach, very effective for lymphedema, but also for any inflammatory process going on in the body. diet, supplements, emotional release techniques, exercises, those cannot be ignored. Those are things that you can do at home and should be doing to prevent recongesting your lymphatic system. So what is manual? Well, manual is using manual massage, where they massage lightly on the skin to force the fluid, the congested fluid, through the collectors and try to carry it through the lymph nodes so that they can be filtered out. The toxins can be filtered out. Typically, when you have a compromised congested lymphatic system, the fluid becomes very thick. It can even turn into a butter consistency, then cottage cheese, and then fibrotic. So those are the different phases of congestion of the lymphatic system. Now, when you see lymphedema cases, it's usually the butter, cottage cheese, or fibrotic stages. And we have used for many, many years manual lymphatic drainage, and that's what I'm trained and certified as a lymphedema specialist, manually trained. So we would do massage in conjunction with compression bandage like you see here, and then once we were able to get the extremity completely down, we would put the patient into compression garments. The problem I had with this is that patients aren't compliant. It works to remove lymphedema, but they're not compliant because it requires them coming into my office every day for a significant period of time, where I'm massaging them and bandaging them, and then they go home, and then they come back, and we do it again over and over again until we can stick them in a compression garment, which they will wear the rest of their life. So this is why they're not compliant. And so I had to look for something different, something that I knew that clients could be compliant with, and that is where I got involved with the inert gas ionization. When I used this with that very first client who had the lung cancer and the fluid built up on his lung, I started using it for all clients, and because they all had an inflammatory process in their body. Now here is a picture of thermography before and after lymphatic drainage using assisted lymphatic therapy. Back then we called it electrolymphatic therapy, but you can see that the before picture, this lady had quite a bit of inflammation in and around the breast, and after therapy, it was able to clear significantly. So assisted lymphatic therapy, it's very gentle, it's a light touch, non-invasive technique that offers qualified therapists a natural complement to any existing protocol that they're using with their client. When implementing this type of therapy, you can expect better absorption of the nutraceuticals and pharmaceuticals. So you need to pay attention there. And if you have a client that's on a huge list of pharmaceutical drugs, you as a practitioner need to work with their doctor in helping them to decrease the dosage, because they're going to have better absorption. And if you are a client and you're on a huge amount of pharmaceutical drugs, you need to talk to your doctor about this therapy and let them know that you're going to be receiving this therapy and that you would like them to try to start reducing medication. So work together with your therapist and your doctor, and you will get amazing results. And so what makes this so compliant is that instead of coming in every day for therapy and leaving in bandages, clients can come in once a week, at the most twice a week for certain cases, and it's an hour, hour and a half therapy. It's a full body approach, where the manual is typically just dealing with the involved area. And so you get a reduction of therapy time by more than 50%. Okay, so they come in for an hour, hour and a half. They don't have to do compression bandage. They don't have to do, in most cases, compression garments. And so therapy time's reduced. They can have a normal life and be free of the pain and inflammation and the swelling very quickly. Overall lymph stimulation response is greatly enhanced. I have seen that it boosts their immune response about 200% each time that they have it done. critical when you're dealing with chronic illness. Many therapists use it as pain relief because inflammation causes pain. So chronic inflammation, we have therapists that use it pre and post-surgical applications. We work with some plastic surgeons and help their patients to heal faster after procedures. And so you can use it for many different types of conditions and use it as an adjunct to other therapies. So let me show you some case studies, and I'm just going to briefly go through just a couple of these. I'm not going to go through all. But this was one case study. She's a 60-year-old female, and she was actually seeking treatment back in 2017 in August from multiple medical doctors. She had a rash outbreak in her legs that caused discoloration, lesions. It started oozing and weeping. Her doctors tried to treat her with first antihistamines, then antibiotics, and then steroids, and nothing seemed to help. Now, she felt that it was due to a bad batch of bioidentical hormones, but upon further testing, she had high levels of fungus loads, mycotoxins, parasites, Borrelia and other co-infections, retrovirus, and mercury toxicity. So in my opinion, her lymphatic system was just so overwhelmed. The bioidentical hormones were just like the straw that broke the camel's back. They really weren't the problem. It was just the lymphatic system, the overwhelm and the congestion that was the problem. So started her on a 4-week parasite cleanse with supplements. We did assisted lymphatic therapy weekly, did some emotional work to help her resolve some conflicts with authority that showed up in her biofeedback, and this was her results. The middle picture is the one when she came in. You can definitely see the discoloration in the leg, in the oozing and weeping. Her ankle measured 9.5. And after therapy, it went down almost a ½ an inch. And so that was just after one session. The client reported that she was sleeping without getting up. The excessive itching that she had in the legs subsided. The edema reduced, and along with the discoloration from one session. By the second session, which was a week later, she continued to see reduction in swelling. And by the 4th session, she sent the picture to this picture to my right. She sent that in, and you can see definite improvement, discoloration gone, itching better, no swelling. And so she continues to have therapy for overall health. This is also a 65-year-old female with edema in her left foot. She had a ½ an inch reduction after the first session in the foot, and then an inch in the ankle. And after a second, she continued to decrease the swelling, and she continues to receive treatment weekly because it makes her feel so good. This is a 60-year-old female. She had a lot of symptoms. She had heaviness in the legs affecting her mobility. She became very stagnant because of the pain from her symptoms, fluid in the legs and ankles. She was diagnosed with fibromyalgia in 2001. She had severe brain fog, extreme anxiety. Does this sound like a lot of you or a lot of your patients? She had burping 40 times plus daily, so you know she had some gastrointestinal distress, sleeplessness, extreme muscle weakness. Just after the first session, she had an inch reduction in the swelling in each leg. She reported that the legs were less heavy and that she was able to walk up a few stairs to see a neighbor on a slight incline, which she hadn't been able to do prior. After the 3rd ALT, the client reports better mobility, giving her the freedom to walk 0.8 of a mile around her neighborhood. She hadn't been able to do that in a year and a half. So this is huge. You can change the lives of your clients. You can change your life if you change your behavior and you implement modalities such as this. She continues to get better and better. I'm going to share this. This is a non-Hodgkin's lymphoma case that I had. 5 months before diagnosis, doctors thought he had congestive heart failure, and his liver was twice the size of a normal liver. Doctors found extensive supraclavicular, mediastinal, epicardial, and bilateral axillary tendinopathy. Remember, tendinopathy is swelling of the lymph nodes. Tumors found in the abdomen the size of a volleyball. He had an enlarged spleen. He was finally diagnosed with stage 4 and was given 1 year to live with chemotherapy, radiation, and surgery. And so he chose to do that. But then it started to get worse. His cardiac conditions worsened. He had gastrointestinal perforation, chronic bleeding, sepsis, brain damage. Lastly, the doctors just said, hey, Doug, I'm sorry, your immune system has failed you, and there's nothing else that we can do for you. This is when I met Doug. He came to me, he was very, very weak. Still lots of swelling in his lymphatic system, so we immediately started assisted lymphatic therapy 2 times a week to reduce the swelling in his liver and his lymph nodes. We tested him with Zyto biofeedback. We did heart rate variability and BIA. I wanted to see if he was in the state of cachexia, and that would determine what type of diet style I would put him on. We did some emotional work, and we just started praying. 6 months later, there's no visible signs of cancers, no cardiac issues, and no endinopathy. He's enjoying life to the fullest. You can also use this therapy, guys, on animals. The same as you do in the same conditions as you do for humans can be done for animals. I'm going to show you just a couple of case studies because of time restraints. But even cats like this therapy. And so if a cat likes this therapy, then you know it's therapy that most people can tolerate. This is Dr. Marlene Seagal. She's one of the leading veterinarians in our country. And I consider her the Dr. House of veterinarian world. If you have an issue and you don't want to give up on your animals, that's who you're going to go to. She's down in Tampa, Florida, and she is one of the best veterinarians I've ever met. But she uses this modality that I'm going to share with you in her practice on her animals with great success. I'm going to show you 2 cases that all of these are amazing cases. I wish I had time to go through, but let me show you 2 of my favorite. This is Daisy. And now I have a little Yorkie named Daisy. So this little Chihuahua is just so dear to my heart. She has an acute herniated disc. So she is unable to walk, as you can see here. She cannot move her back legs. Most veterinarians would put her down at this point because it creates a lot of pain, a lot of suffering for the animal. Dr. Seagal did not want to give up, so she started doing lymphatic therapy on her. She did it daily. This was after a couple of days of therapy. She got her up, walking, her standing on her own, on her hind legs, after doing assisted lymphatic therapy. She removed the inflammation that was causing the pain. And then you see on the right side, my right side, that the dog is actually
okay, now she just pulled her feet forward. Did you get that?
After probably just a few sessions.
She just pulled her feet forward. You can actually see she's knuckled.
This is another dog with acute disc herniation and was seen by Dr. Seagal, same type of conditions, dragging her legs. She'd been paralyzed for over 5 weeks. She came in February 2019 to see Dr. Seagal. Dr. Seagal began to do intensive therapy for 7 days. This was after she, day 4 of lymphatic therapy, she was able to stand.
She's on her own. Back her up.
On her own.
Get her feet nice and placed.
Very shaky, but she was able to stand after being completely paralyzed for 5 months.
She's all on her own.
This is her after 14 days. You can see she's able to walk and run. with little to no discomfort. All right, so guys, I thank you for your attention, and I hope you learned a little bit about the lymphatic system and how important it is in your role or in your journey to health. And so the lymphatic system is a system that cannot be ignored. And what I want you to take home with you is that the lymphatic system, if you stimulate the lymphatic system, you're going to stimulate all the other systems of the body to work more effectively. It's all connected. Okay, so as we're working on your lymphatic system, we're also supporting and helping the circulatory system to flow better and decongest it. We are helping your endocrine system. We're cleaning out the endocrine glands that regulate and run every other system of the body. So there's great benefit to this type of modality in any practice and for any client with any inflammatory process. And so I encourage you to seek out a therapist. If you are a client watching this video and you need help and you kind of just feel like you're stuck in a rut and you're, no matter what you do or what diet you do or supplements you take, you just can't get better, do lymphatic therapy. It will make all the difference in your life. And if you're a practitioner and you're just tired of struggling with these difficult cases and you feel like you're, like I did, you're hitting a wall and you want to give them a better chance of overcoming chronic illness and help all the modalities that you've learned years work better, please take in consideration this type of therapy modality, implement it in your practice. You can contact me, Dr. Jennifer Grameth, at Right Way Health and Wellness by either sending me an email at admin@rightwayhealthandwellness.com or call my office at 404-474-2100, and we will set you up with a demonstration if you're a practitioner. If you're a client who has had this therapy and you are so amazed by it and you want to teach other people and actually help other people do this therapy and become a lymphatic therapist, contact me and we will talk further. So I wish you a great and healthy, prosperous week, and I am here to serve you guys. And so feel free to contact me at any time. I thank you. God bless. Take care.